Pulp vitality tests. Introduction. Pulp vitality test is a diagnostic procedure to determine pulpal status by the assessment of blood supply to the tooth. Uses of pulp testing. It is done before carrying out restorative or orthodontic treatment so as to know status of the tooth even if teeth are asymptomatic and with normal radiographic appearance. To confirm whether radiolucent area present at the apical part is of tooth because of pulpal origin, other pathological reasons, or is it a normal structure. Classification of pulp testing: heat test, cold test, electric pulp test, anesthetic test, and test cavity. Heat test. Various methods have been proposed for heat testing. These include heated ball burnisher, a rotating rubber polishing cup, a heated gutta percha stick, an electronic device, the application of hot water, and laser. Cold test. Dry ice sticks, refrigerant sprays, dichlorofluoromethane, tetrafluoroethane. The patient may respond to heat or cold test in the following possible ways. Mild transitory response to stimulus shows normal pulp. Absence of response in combination with other tests indicates pulp necrosis. An exaggerated and lingering response indicates irreversible pulpitis. But there are certain conditions which can give false negative response also. These conditions can be recently erupted teeth with immature apex, recent trauma, and excessive calcification. Now, electric pulp testing. The objective is to stimulate a pulpal response by subjecting the tooth to an increasing degree of electric current. A positive response is an indication of vitality and helps in determining the normality or abnormality of the pulp. No response to electrical stimulus can be an indication of pulp necrosis. Clinical interpretations of pulp response to electric pulp testing. Normal response. A positive response is a response that occurs at the time of neural excitation threshold as a control tooth. Negative response. This denotes a non-vital tooth which fails to respond even when the tester is set to a highest electrical excitation value. Early response. This denotes a diseased state of pulp as the tooth responds to a threshold which is less than that of the control tooth. Delayed response. This also denotes a diseased state of the pulp wherein the tooth responds at a significantly higher electrical excitation level than compared to the control tooth. False positive response is when a gangrenous necrotic pulp is present in the root canal. In multi-rooted teeth in which the pulp is partially necrotic with some fibers still vital in one or more of the root canals. False negative response is in extensive calcification of pulp tissue or dentin in a tooth with increased reparative dentin and a diminishing pulp cavity. Fibrotic pulp, teeth with extensive restoration and pulp protecting base, and recently traumatized teeth. Next, anesthetic test. This test is restricted to patients who are in pain at time of test when the usual tests have failed to identify the tooth. The objective is to anesthetize one tooth at a time until the pain disappears and is localized to a specific tooth. Test cavity. This test allows one to determine pulp vitality. It is performed when other methods of diagnosis have failed. The test cavity is made by drilling through the enamel dentin junction of an unanesthetized tooth. The drilling should be done at high speed and with a water coolant. Next is bite test. This test helps in identifying a cracked or fractured tooth. This is done if patient complains of pains on mastication. Tooth is sensitive to binding if pulpal necrosis has extended to the periodontal ligament or if crack is present on the tooth. Next are the newer techniques: laser Doppler flowmetry, pulse oximetry, crown surface temperature, transillumination with fiber optic light, photoplethysmography, dual wavelength spectrometry, ultraviolet light photography, transmitted laser light, detection of interleukins, and 133 xenon isotope. Thank you.